you working on?
This is a full gold crown number 30. Here we go. So the first thing that we're going to do is open up the interproximal with a pointed diamond, and any pointed diamond will do, as long as it's on the skinny side and there's adequate height so that you can pass through the interproximal without damaging the adjacent tooth. So I'll go ahead and open up the mesial contact first. And you want to try to keep the burr nice and straight, parallel with the long axis of the tooth. And one of the goals of using this burr is to try to maintain that little shell of tooth structure that will help you protect you from nicking the adjacent tooth. So here I'm engaging very carefully. So right now I am establishing the axial inclination of my mesial axial wall. And you notice that I'm doing a pretty good job of maintaining that little shell of tooth structure. And I know that without stopping that I've done a good job of protecting the adjacent tooth. Okay, and so and you'll notice that I have that little shell of tooth structure right here, and if I just moved it this way it would break, but I'm going to show you later on how this will just sort of fly off using a larger chamfer burr. When you're looking at your mesial axial wall, imagine that you have this long axis of the tooth here and you want that to be as parallel as possible. If you start tapering meaning towards the center of the tooth like this, you're going to have problems maintaining good retention form. So make sure that when you're holding the burr that it's nice and straight, upright, and it's parallel with the long axis of the tooth as you're making the pass from buccal to lingual. So now what I'll do is go ahead and do the exact same but for the distal side. Okay, so I've now cleared the distal, and as you can see, I have that little shell. You can see it sort of shaking in the wind there, and you notice that I have nice parallelism of the mesial wall and also the distal axial wall as well. So at this point, I have two options. I can either continue to work on the axial wall, so the remaining walls would be buccal and lingual, or I can now go ahead and move and work towards the occlusal reduction. So for this one, I'll go ahead and move to reducing the occlusal about 1 millimeter on both the buccal and the lingual cusp. And to do that, I'm going to go ahead and change out my burrs. And I'm going to switch to the flat taper, and as you can see the tip here, it's flat. It's rounded, but we'll just say it's flat. Okay, so that should be fine. So I'm going to use, and you notice that the color is blue, meaning that it's a medium grit, so this should leave a very rough surface, which later on I'm going to go ahead and smooth out using a fine grit diamond. So one of the things that you want to try to keep in mind as you're prepping, it's very important that you try to maintain the central groove throughout your crown preparation, and the way you can do that is reference the adjacent teeth. And so here I'm going to try to maintain the central groove here after I've reduced the lingual half and also the buccal half. You notice that this is a mandibular tooth, so our functional cusp bevel is going to be on the buccal side of the buccal cusp, which is on this side here. So by the time I'm done, you'll see a three-plane reduction: lingual, buccal, and then buccal. And so 1, 2, 3-plane reduction. Okay. On the maxillary, it would be different because the functional cusp bevel would be on the lingual side of the lingual cusp. So I'll go ahead and complete the occlusal reduction now. So the first thing that you want to do is put a depth guide right along the central groove. And I know that the diameter of this burr is about 1.1. I'm just going to go ahead and bury just about maybe 3/4 of the way. So I'll put one on the central groove, and then the next one I'll put is one on the triangular ridge of the mesiolingual cusp. And it's important that you try to maintain the cusp angle throughout your depth guide. Good, right there. And then the third depth guide will be on the distal lingual cusp. And you notice that I'm not angling my depth guide this way, I'm making it perpendicular to the central groove. Okay, so you notice that I have 3 depth guides that are terminating right along the central groove. And you notice that from the distal marginal ridge to my depth guide, it slopes up. From my depth guide to the middle depth guide, it slopes down, and then back up, and then back down again. So as I'm reducing the lingual half of my tooth preparation, I'm going to try to follow that morphology as best as I can. So here, I'm going to prep sort of in a downward motion to create that downward slope. And you notice that this is a bit more difficult if you don't have the interproximal clearance. Okay, and I'll go ahead and work on the downward slope from the mesiolingual to the central groove. And you notice that I don't do this too much. I always start from the top, go down, start from here and go down this way so that it creates a nice upward and then a downward slope. Okay, we'll do the same for here. Okay, so now when you look, you notice that I've done a pretty good job of maintaining the occlusal morphology on the lingual half. So we have the distal slope going down, medial slope going down towards the central groove, and here we have the distal and medial. So up, down, and that looks pretty good there. Okay, so now I'll go ahead and proceed to do the buccal. Okay, so the buccal half. And so again, I'll go ahead and position my burr. And we'll bury the burr about maybe 3/4 of the way down. There's one depth guide. Put one more right up here. So here I put 4 depth guides. Okay, and same thing, I'm going to go make sure I start from the top of the cusp tip down to the groove and vice versa for both mesial and distal slope. Yeah, what you'll find with tooth number 30 is that this distal buccal cusp can give you some problems. So if you find that there's an area where you have a groove and a very small amount of tooth structure, just go ahead and blend that in as part of the larger cusp here, and I think that should be fine. So for here, there'll be a tiny little groove, and I'm just going to create a little downflow into the distal marginal ridge. I think that should be fine right here. So one of the things I noticed when I was looking at a lot of students' prep was that they would leave this transition area here where it's from the lingual hair and buccal hair, and you would leave this area. So to correct these areas, what you can do here is once you've done your occlusal reduction, go ahead and take a burr and just kind of create a little trough into that area, just blending both sides together, and you can do that with a rounded diamond. That should be fine. And you can always go back and use a fine diamond just to verify that. Now I've done a pretty good job of blending both sides together. You notice that if you use the tip of the burr, it tends to gouge or create little gouges, so make sure that after you've done that, go back and refine your prep by using the sides and the tip of the burr simultaneously. And again, make sure that you try to preserve the original anatomy as much as possible. And later on I'll show you what I do with the fine diamond to get rid of a lot of these irregularities created by the coarse grit diamond burr. So now I have my first plane, my second plane, and I'm now ready to do my functional cusp bevel. Now keep in mind that the functional cusp bevel is very important because it doesn't have a dimension, and the way you figure out whether you have adequate amount of reduction on the functional cusp bevel is you have to ask the patient to move their jaw to the right side, because in this case we're working on tooth number 30, which is on the right side. And depending on the amount of canine guidance that they have, it will create separation. So sometimes you may just have to do a little bit of prepping to create your functional cusp bevel, and for some patients who have a very deep bite, you may have to do quite a bit or quite a substantial amount of reduction just to get that clearance. Because keep in mind that you're going to ask the patient to do the same type of movement once the actual permanent crown has been cemented. And you don't. And the worst thing that you can do is try to create occlusal interferences that weren't present in the beginning. So for the basis of learning, I'm going to create a 1 millimeter functional cusp bevel on the buccal side of the. So I'm going to go ahead and start the functional cusp bevel. And the idea is pretty much the same. So we're going to go ahead and create a depth guide about 1 millimeter or about 3/4 to about 4/5 diameter of the burr. And so here I'm engaging the groove. I'll place another one up here. And you notice that I'm not burying my functional cusp, down to the middle half of the tooth. Functional cusp is usually just restricted to the occlusal 1/3 of the coronal morphology. So go ahead and blend that in. And again, you'll notice that if I didn't have my interproximal clearance, it wouldn't allow me to create this downward prepping motion to maintain that nice medial buccal cusp anatomy. So here we have a nice reduction here. And again, you notice that I'm, very rarely making this type of movement. I always make sure to go up to the cusp, and then make sure to go down the cusp, and that's what creates this little line angle here. So I'll go ahead and do the same for here. Okay, so that should be the functional cusp bevel. So now we have one plane, we have the second plane, and we also have the third plane here, which is our functional cusp bevel. Okay, and again, this is a bevel that if this was an actual clinical case, and I'm working on a patient, I would make the initial prep and ask the patient to move their jaw to the right side to make sure that I have adequate amount of clearance. But for what I did here today, I think this should be adequate. And I'll go back later and refine that area with the fine grit diamond burr. So now I'm ready to do the axial wall preparation and establish my finish line. And the way we go about doing that is we're going to go ahead and create depth cuts into the axial portion of the buccal and lingual wall. And one thing to keep in mind that I like to do is you'll notice that you'll have a situation where some teeth are tipped or some teeth are rotated, but the main idea is that you have to think about the fact that the crown that you're going to be cementing needs some type of passive placement. And the best way to establish that is to envision a long axis of the tooth that you're working on. And what you want to do is you want to try to make sure that your passive insertion is parallel with the adjacent tooth. So here in this case, tooth number 29, and in this case, tooth number 31. And so as I'm doing my depth guide, those are some of the areas that I'm going to focus my attention on. So here, here, and here. And so when I do my depth guide, and if you're prepping this for the first time or second time, you may want to start off with a conservative depth guide. Just make sure that you create some type of a prep. And you can stop at this point and double check to make sure that it's parallel with tooth number 29 and that it's also parallel with tooth number 31. And to me, from where I'm sitting, this looks pretty good. So once I have made my first depth guide, I'll go ahead and prep another one right along this area. And I'll try to make this one parallel to the one that I made earlier. And you notice that right now I'm not establishing my finish line. The only thing that I'm doing right now is trying to get my axial wall nice and tall without too much taper. Okay, and I'll go ahead and check here, check here, check here, and check here, and everything seems to be in order. So I'll go ahead and place another depth guide along the distal. And you notice that in certain parts of the tooth where the tooth is a little bit more rounded or has more of a bulge, your depth guide is going to be a little bit deeper. So here in the distal buccal area, you'll notice that there's a greater amount of undercut. So my depth guide here is going to be obviously a little bit more deeper than, let's say, the buccal area, which is a little bit more flatter. So I'll put my fourth depth guide between the two. So now you can go ahead and stand back and take a look. And I noticed that my depth guides have sort of have this mesial tilt from where I'm sitting. So I'm going to go ahead and correct these depth guides by uprighting these just a little bit. Okay, so I'm going to go ahead and make this one a little bit like this. And then I'll reevaluate, and that seems to be okay with the exception of that depth guide right there. So I'm going to correct that a little bit more. Okay, and yeah, so I'm okay with the 4 depth guides that I produced. And so at this point what I'm going to do is go ahead and connect all of the depth guides and establish my finish line 0.5 millimeter of the gingiva. And I'm going to extend my finish line about midway to the mesial contact and midway to the distal contact as I'm preparing the buccal axial walls. Alright, here we go, here we go.
Can I take my instrument?
And make sure that you try to lock your wrist, keep your fingers nice and loose because you don't want to have them start cramping midway through your prep. And just make sure that you have a nice fulcrum. Here I'm using the pinky and the ring finger. And I'm just going to do a nice reduction and try to connect all 4 depth guides and just carefully lower my finish line down about 0.5 millimeter above the gingiva. And a lot of this is just maintaining good form and making sure that you have adequate amount of reduction. And I'm using a rounded diamond, so that's going to naturally form my chamfer finish line. And you notice that as I'm extending into the mesial, that shell that I created when I was making my interproximal reduction, it's going to fly off as I get more closer and closer to the lingual side of my tooth preparation. So here I went ahead and just sort of connected the two, and I'm rounding out the mesial buccal line angle. Now I'll go ahead and maybe put another depth guide here and then connect the two together. And I'm lowering my finish line, going up. So far, so good. You notice that here on the distal buccal, there's a bit of a bulge, so there will be a little bit more tooth reduction here on this side. So I have to try to establish my finish line. Try to round out that distal buccal line angle. I'm beginning to find that it's very hard to prep and talk at the same time. So we'll see how it goes. Okay, so now you can see that I have my finish line. It's slightly jagged, but I can make those refinements using the fine diamond. The distal shell that used to be there is no longer there, but you can see that the mesial is still intact. And so as I engage more into the mesial contact, you will notice that portion disappear or fly off. So I'm going to go ahead and now refine my finish line on the buccal, extending it from the mesial contact to the distal contact. Oh, there it goes. Okay, so I now go ahead and remove that shell. I'm going to carefully remove some of the irregularities in the finish line and the mesial. You will notice that I am nicking the adjacent tooth a little, but that's okay as long as you don't gouge the tooth too much. So I'm going to make a very quick pass. And you notice that I have enough clearance to a point where I can lean the burr towards the center of the tooth, refine my finish line, but not really affect my axial wall angulation. So now I have a nice clean chamfer finish line on the mesial. I'm just refining the buccal a little bit more. The reason why you want a nice clean finish line is, number one, your restoration will have a nicer marginal integrity. Number two, impression making is much easier. And number three, your provisionals will fit a lot nicer. So it's important that you spend a little bit of time refining your finish line. Okay, so now a couple things that you can do to make your prep look really nice is you'll notice that these are little line angles here. So what you can do with the fine diamond is go ahead and sort of blend this line here so that you have a nice rounded transition as opposed to an angulated transition. So let me go ahead and switch out the burr. And so I'm using a red stripe, and that usually indicates that it's a fine, coarse diamond. And I'm going to go ahead and just very carefully blend the two different line angles and make my prep look really, really nice. And you don't have to put too much pressure here. All you're really doing is just sort of blending the line angle away so that it blends in nicely. And you can hear the handpiece, and I'm just using variable speeds just so that I can get a nice finish. Kind of want to make these nice quick motions. Try to maintain a nice plane here. And don't just use the tip of the burr, but try to use the medium portion of the burr so that you get a nice shine there. And you notice that the line angles are slowly starting to disappear. And you have a nice transition from the Occlusal third to the axial wall. Here on the lingual, you notice that it looks very rough. So I'm making the same motion. So here's the downward. Here's the downward motion. And here's the downward motion. Okay, and then we'll do the lingual half. Okay, so it's pretty good there.
Looking great.
Okay. Good. Alright, so now I'm going to go ahead and now put the depth guides on the lingual axial wall. And right now I'm sitting at about 11 o'clock position, and I have the patient's head sort of tilted. Normally this is probably a bit unusual for a clinic setting because a lot of times the cheeks and the lips sort of get in the way. So in the clinic, what I would normally do is sit usually at 6 o'clock or 7 o'clock to prep the lingual axial wall. But for the purposes of learning, I think this will be a good, helpful way for you to sort of visualize what it is that you need to do in order to get a nice lingual axial wall preparation. So I'll go ahead and go back to my rounded diamond to create my nice chamfer on the lingual. And I'm going to go ahead and place about 3 depth guides. And before I put my depth guides, I want to make sure, I want to gauge and make sure that I have a nice parallel axial wall on the buccal. And I want to try to reproduce that same wall with the same angulation on the lingual as well. So I'll go ahead and put my initial handpiece position here. And now I'll go ahead and lock my fingers and my wrist and just kind of transport that same position onto the lingual as well and create my depth guide there. Okay? And same thing, if you're a bit unsure, you can just create maybe a depth guide about half the depth. So that one's pretty good there. And I'm going to go ahead and use a mirror to evaluate the depth guide. And this one is favoring a little bit towards the mesial, so that means that my handpiece was kind of angulated that way. So I'm going to make my correction here. Okay, and I'll take a look. and that one seems to be a little bit more upright. So that looks pretty good there. I'll go ahead and put another one right along the center. Try to make that parallel with the first depth guide. And again, you want to try to stay a little bit above. Remember, depth guides are just to help you orientate what your final axial wall is going to look like. So here, that one looks fairly parallel, and that one looks pretty good. I'll go ahead and place 2 more. Okay, so my final product should look something like that, where you can see 4 axial walls. And at this point, it would be a good way to make sure to kind of check. So I would grab my angulation here and hold this position and go ahead and transport that over. And I can now see the buccal axial wall, and at the same time I can see my depth guides, and so I know that I don't have undercuts along the lingual here. So I'll go ahead and now blend all of the depth guides on the lingual side, and then evaluate the tooth to see if there's adequate amount of reduction and look for any undercuts that I may have produced. And remember to make sure that you prep enough along the line angle, because that's a very tricky area because it's a turning point. And so a lot of students will leave sort of like a knife edge finish line. But if you're having trouble, one thing that you can do is just go ahead and put a depth guide right at the line angle. And that will help you kind of secure an adequate amount of reduction in that area. So you don't have to worry about rounding that corner out too much. And from where I'm sitting, I can see the entire lingual axial wall. But let me remind you that this is kind of difficult when you're actually doing it on a real live patient. Alright, I'm maintaining. And here on the distal lingual line angle, I'll go ahead and put a depth guide. That will help me blend the lingual and the distal axial walls together. Now what I'm doing is blending the different the depth guides together and just creating one single axial lingual wall. Okay.
I got the other one. You're like, that's for the other here. Very closer to that. Maybe this will make everyone be very excited. Oh, your left monitor? Huh? Left monitor.
Okay, now I'm gonna reposition the patient's head. Okay. Alright, here we go. A little more refining. Right now I'm sitting at about 6 o'clock, and you notice I'm a little bit hesitant with the finish line because I can't see what I'm doing. But you notice that I'm just prepping a lot by feel, and so I'm using a finishing diamond. I kind of messed up right there, but you notice that I'm able to create a nice smooth axial wall on the lingual. So when I'm looking at this prep, I notice that my mesial is slightly over prepped. So later on, I'm going to show you a couple things that you can do to make your prep look a little bit more balanced and a little bit more nicer. And right now I'm working on the buccal finish line where I feel that the distal buccal is slightly under prep. So I'm going to go ahead and refine that area a little bit more. So the prep is coming along nicely. I will go ahead and check for any undercuts. And go ahead and get rid of this.
And how do you check for undercuts?
And the way I check for undercuts, I make sure that I bring the mirror up, and I try to position the mirror so that I can see all of the axial walls like mesial, lingual, and buccal. And usually what you'll find is that if you have a very tall axial wall, you won't be able to see it. So what I like to do is I like to put pencil marks just along the buccal and lingual axial walls, along the maybe about 1 millimeter above the finish line. And if I position my mirror above from an occlusal view, and if I can see all 6 of those marks, then that means that I don't have any areas of undercut. But if I'm only seeing like maybe 4 out of 6 or 5 out of 6, then wherever dot that I cannot see, that means that above that area would be signs of an undercut. And here in this case, I see a little bit on the distal lingual, so I'm going to go ahead and correct that as well. And a little bit on the mesial buccal, so I need to taper those walls in a little bit. Okay. So mesial buccal first, I'm going to go ahead and just taper those walls. Okay, and just the lingual. can't see the mesial lingual. I'm going to go ahead and correct that area as well. Okay. Alright, take a look. And that's actually looking pretty good. Okay, so go ahead and take a video of that. If you look at the tooth preparation, and if you look at the tooth preparation that I created, I'm not too happy about the amount of reduction that I have on the mesial. The distal I like, the buccal and the lingual, it's all very uniform. So one of the ways that you can do to correct that is by creating more clearance from the chamfer finish line to the adjacent tooth. And what you can do is you can go ahead and take a pointed diamond and go ahead and remove just the finish line here, so that you're making this area a little bit more narrower, so that it looks equal to the finish line that you have on the distal. By doing this, yes, you will go slightly sub G, but it will make your preparation look a little bit more balanced. Okay, so I'll try to demonstrate that. And the key thing here is don't hit the adjacent tooth and don't over taper the mesial axial wall. And really what you're doing is just reducing this portion or this area of the finish line. Okay, now when you look, the width of the finish line, the mesial, is still a little bit larger than the distal, but it's definitely a little bit more balanced and has a lot more uniformity along the entire prep. I can do that a little bit more. And that looks like a pretty good finish line there. So for the remainder of the prep, I would just go ahead and look for any sharp areas and use a fine diamond like here to round out any line angles. Remember, it's up, down, up, and then down again. Okay.
Oh, really?
Now I'm just kind of messing around for no reason. So there you go. That's a good prep right there. I would say that the only critique is that the mesial portion bothers me a little bit. but otherwise it should be a pretty good prep.
Okay, thank you, Dr. Ywom.
How's that look?
Looking awesome.
Looks good?
Yes.
Yeah, looks good prep.